Hey guys, this is Dr. Shumard with Integrative Wellness Center. I'm just going to give a couple of seconds for a couple people to jump on to this call or just live today. I've got some really cool stuff to talk about, so I'm just going to give a couple of seconds or so for people to jump on. So let's see what happens. Okay, so as people are jumping on here, I'm just going to discuss a little bit about what we're going to talk about today. And one of the focuses that we do in our practice is we really help patients who are dealing with diabetes. So today we're going to be talking more about diabetes, the health risks that are not only common that many people know, but also the health risks that are going on right now. So let's dive into that. And one thing is with type 2 diabetes, we all know about the typical health-related issues, right? We have cardiovascular issues, heart attack, stroke. We have things like kidney disease, neuropathies that can lead to amputations, and even cancer has been related. So many, many systems that can be broken down with diabetes and causing many, many health-related issues. So oftentimes diabetics tend to have a shorter lifespan. They tend to have more complications. And what's interesting is that these complications are typically going to be due to the underlying mechanisms that are not being addressed from traditional avenues. What do I mean by that? Well, traditionally the mindset is that diabetes is due to the food we eat, and that it's due to that are overweight or because we don't exercise. And those things are true. Those things can be increasing the risk factor of diabetes, like if you're eating poor, like McDonald's or fast food or fats and sugars every single day. Of course, that can leave you at risk for developing diabetes. But oftentimes we see people who have really good diets, who eat really healthy, and are still dealing with a diabetic condition. So there's this phenomenon called cause and effect. Now, cause and effect means that if something is happening, there's a cause that's due to an effect. So if you, inject yourself with heroin, you're going to have a reaction to that heroin every single time. It's going to be the same type of response. Now, with diabetes, it doesn't necessarily mean that you're going to have a diabetic condition developing just because you have a poor diet. We see people who have poor diets constantly who don't develop diabetes. We see individuals who are obese that don't have diabetes, and we see individuals who are super thin develop diabetes. So there's never a specific cause and effect. Now, those things can be contributing factors, right? If you don't exercise, if you're overweight and you have a poor diet, you're increasing your risk factor of diabetes, but you're also increasing your risk factor for multiple other conditions as well. So when you're talking about diabetes, at least what we talk about in our office, is we want to understand the underlying mechanisms that are involved, meaning there's something going on inside that individual's body that is not working properly. Because at one time in their life, they were able to regulate blood sugar. That may have been very simple for them. They could go out and have a piece of pie, some ice cream, some pasta. The next day, their blood sugar would be normal and no issues. So what's changed? Why is that person different? So something must have broken. Something must have broke down in their body where they're no longer able to regulate their blood sugar. Now, what might that be? Well, traditionally in a medical model, we're going to just focus on the elevated blood sugars and try to bring those blood sugars down with pharmaceutical drugs like metformin or glipizide or glimepiride or tons of other medications, roughly about 500 different medications on the market now, FDA approved to address diabetic conditions. So we have to look at things a little bit differently, because if the medications were truly the reason why that person was diabetic, then you take the medication for a little while, get off the medication, and they'll be healthy and back to normal again. But we all know that's not the case. And many people who are struggling with this diabetic condition, maybe some of you who are watching or who will be watching this video in the future, know that when you're given that medication, that first day of diagnosis, you know that it's going to be a medication that you're expected to take for the rest of your life. Now, that can be very frustrating for some people. They're handcuffed taking this medication. So there's more to this than that meets the eye. And on top of that, other conditions start to develop, right? As we mentioned, diabetes has a risk factor for heart attacks, strokes, high blood pressure, neuropathy, kidney issues, and you name it. So a person may start taking 1 or 2 different medications, and the next thing you know, 5 years, 10 years down the road, they're taking 10, 12, 15. In my office, I have seen individuals taking upwards of 30 different medications every single day. And no one even questioning that that's not normal. Well, obviously, hopefully, those of you who are listening or will be listening into the future think that that is not normal. Something is wrong there, something is broken. And when we're not looking specifically, I mean, truly analyzing an individual, not based upon their symptoms, not based upon what type of medication they need, but truly understanding what's going on. If you took your car to a mechanic and the mechanic said, here, take this, give this to your car, and let's see how your car does, come back in 6 months. That sounds foolish, right? But if you took it to a mechanic that did a diagnostic check, like checked everything out, looked to make sure everything was working and functioning properly, and found the areas that weren't and told you this is not working, we need to fix those problems, that would make more sense and we'd be more comfortable with that. So why don't we expect the same out of our doctors and our health? Why are we okay with just taking something continually for the rest of our life and never understanding the true mechanism or the true problem of what's really going on? Well, that's what we do here in this office. That's what we do. We dig and we dig and we dig and we find and we eventually unravel what is going on with that individual. I can tell you from my perspective, every single time I've been doing this work for many, many years now, I've been in practice for over 15 years, that I've never seen 2 diabetics with the same underlying problems. They're always going to be unique and different to their underlying mechanisms, their problems. So if we have each and every diabetic that has a different problem, different issue, that must mean they require different, unique treatments, all the way down to the diet. Of course, there's no one-size-fits-all diet. If you believe that or have heard that, you've heard wrong information. Now, we could probably change. I could give you a diet right now and tell you, say, eat this, and I guarantee it's going to lower your blood sugars. Well, if lowering your blood sugars is your only goal, if lowering your blood sugars is your only objective, then the work that we do in our practice is not for you. Because, of course, we want to see the individual's blood sugars going down, but we want to actually help them get to a point where they may no longer need the medication, where they're regulating their blood sugars on their own, giving their body their own ability, their God-willing ability to regulate their blood sugar on its own, because we know that it can, because you did it before in the past. It's all about healing. It's all about focusing on, what your body needs and not what is trying to, change some mechanisms so it looks good on paper. So we have to really look at things differently. I like to talk about looking at things from 35,000 feet down and really the individual, not because you have a diagnosis of diabetes, not because you have a diagnosis of heart disease or blood pressure. Whatever those symptoms are, they are stemming from something else going on. Just like the roots of a plant have to be strong, and eventually the tree grows and the branches come off that, disease is no different. If there's underlying problems, the roots, as I call them, eventually something's going to surface, and whatever symptoms are going to develop, which would be the branches or the fruit, whatever you want to use as your analogy. So looking at things more uniquely for the individual. Once you uncover that, once you unravel that, very simple. It's very easy at that point to customize the proper nutrition the person needs. Maybe they need some nutraceuticals or supplementation, some herbs that are specific to giving their body the ability to start healing again on its own. That's the overall focus. How can we help that person start healing on their own? We all have the ability to do this. If you want to challenge me on that, go and cut yourself. No, don't do that. But if you were to cut yourself today or get a cut, do you have to do anything about that? Do you have to tell your skin to grow back? Do you have to tell your immune system, please fight the infection? Grow the skin back, make sure everything looks good, come back to the similar color I was before, all those things? Absolutely we don't. It does this on its own. The body has the ability to heal on its own if everything is working to optimal function. And that's what has to happen. That is the focus of what we look at every single day, is how can we help this person to restore function so then they can go back to living the optimal life that they deserve, to spend time with their family, their loved ones, and be here on this amazing earth for the rest of their life with a quality of life not hooked up to machines, not forcibly taking medications every single day that are potentially causing other underlying mechanisms and problems getting worse and creating other diseases as well.